name is Trevor Mokel, and welcome to the Mendocino County COVID-19 update. Today, we are pleased to be joined by Mendocino County Health Officer, Dr. Andy Coren, who will give an update on the COVID-19 status of our county. After that, we'll open up to take a few questions from the media concerning the COVID-19 incident, limited to 2 questions from each media outlet in order to preserve the schedules of our staff. If time allows, we'll also take questions from the public. If you're a member of the public, please leave a comment on the video, and we'll do our best to address it. Now, beginning with the health update, Dr. Coren, you have our attention.
Thank you very much. Welcome, everyone. So I'll present, as usual, the data first. And the first bit of information comes from a couple of days ago, May 12th. In the United States, the coronavirus cases now amount to 32,307,053. The deaths are 583,547. In that regard, the U.S. is still number one. There are significant outbreaks continuing in Minnesota, Michigan, New Zealand, the Northeast, and Puerto Rico. In California, our cases number 3,658,198, and new cases per day amount to 3.6 per 100,000. We've had 61,305 deaths, and our test positivity in California is 1.1%. In Mendocino, as of today, our average daily new cases is 5.17 per 100,000, and our case positivity rate is 1.2%. I want to alert the audience here that we've had some days with very high numbers recently, and this can sometimes get obscured by these averages. Just on Wednesday, we had 15 reported new cases. Yesterday, we had 8 cases, and that really has me worried. Please note that these cases have all been in unvaccinated people, and I'm going to return to this in a minute. The total cases in Mendocino County, number 4,078. Of those, 2,011 are from the Hispanic community. We currently have 46 in isolation, 42 who are quarantined, and the deaths now number 49. In the hospital, that has also taken an increase. We have 2 on med-surg and 2 currently in the intensive care unit. One of those people is in the intensive care unit at University of California, San Francisco, due to severe COVID associated with her pregnancy. And I will also address that in a minute. Outbreaks, we have just closed the outbreak for a family business in Willits, and there are no current outbreaks, although 4 school cases are open, again, all unvaccinated. We do have some high-risk cases and clusters in public-facing roles. And these are young people who have not been vaccinated. Contact investigation and contact tracing continues and is just as important now as earlier this year in order to rapidly mitigate the outbreaks, as well as following up these reports of whole genome sequencing to see if there's anything more coming into our community. I am concerned that we might be going through what we saw 14 months ago, where a few cases were seen here and there, and we later found that this was a smoldering fire just waiting to explode, which it did over the winter. But it has now become clear that we are seeing this epidemic affect 2 different worlds. Those who are vaccinated are not being involved in current cases, and those who are unvaccinated, who are taking the brunt of the current cases. For the vaccinated, there is generally no quarantine required in people with close contact, except those with symptoms, and there's a relaxing of restrictions, for example, with gatherings and travel and the use of masks. In the world of the unvaccinated, this virus is still continuing to spread, and it is affecting the most vulnerable, the elderly, those with cancer, those with immune deficiencies, and pregnant women, who may not even know that they are pregnant yet. And this is much more severe disease in pregnant women leading to preterm births and to miscarriages. Research has also been very illuminating in the effects of long-term COVID, even among young, healthy people. Lancet recently published a research article showing that neurologic and psychiatric long-term consequences affect 2 to 5 times more people who have had COVID than those who have not. And this is people with no known risk factors other than COVID. There is now data showing the neurodevelopmental effects in the babies of women who were COVID positive during their pregnancies. And this, in some ways, mimics what we had seen in perinatal measles, which is now controlled with childhood vaccinations, or the recent outbreaks around the world of Zika virus, which is a mosquito-borne virus, which included increased risk of neurological diseases, and that included cerebral palsy, learning disabilities, autism, and schizophrenia, which may not even be apparent for as long as 2 to 20 years later. For this reason, the American College of Obstetricians and Gynecologists and the Society of Maternal and Fetal Medicine support COVID vaccine for pregnant and nursing mothers. Those who remember how long it took to understand the effects of chronic Lyme's disease should also appreciate how the information about COVID is coming to light this early in the course of this pandemic, and while there is an effective prevention with vaccination. So for those who still choose to live in the world of the unvaccinated, expect to have more hassles with travel, more hassles with attending large events. And I have 2 pieces of advice. The first is get vaccinated. And the second is, until you do, continue to mask, continue to keep your distance, keep the windows open, use the hand hygiene, and test often. I'll move on to surveillance testing. We continue to have surveillance testing every Sunday to Thursday from 9 to 5 p.m. at the Ukiah Fairgrounds, and in Fort Bragg at the Vets Hall every Tuesday from 9 to 5. Our travel team is visiting today at Potter Valley for a special surveillance response, and in Gualala, Boonville later in the day. People being tested with symptoms should go to their clinics or providers on weekdays or the emergency room if they're very sick. The schools are now testing some staff and especially athletes regularly, as more high school sports-related cases have been reported in California, and this was involved in the recent cases we have seen here in Mendocino. We've had rare positives after fully vaccination and none recently in California. This amounts to 0.026% of fully vaccinated people who test positive for COVID. These cases are mild. In Mendocino, none have resulted in hospitalization or death. This is such a small number that the California Department of Public Health prefers no longer to refer to this as breakthrough, as the number is actually much less than would have been expected. Variants in Mendocino County. We have received reports of over 150 tests for variants, the whole genome sequencing, that were done by the state network called COVID-Net. These initially, dating back to January, showed no variants of concern in Mendocino. Subsequently, we saw the West Coast or California variant of concern, B1427 and B1429, which have an increased transmission rate of 20%. These still predominate, but in March we saw our first report of the UK variant B117, which is 50% more transmissible and more virulent. The most recent report shows more UK variants and one from Brazil, the P1 variant, which is more transmissible and virulent and possibly somewhat more resistant, not 100%, but somewhat more resistant to vaccines. South of us, there have been several of the double mutant Indian mutants or variants, and this has us very concerned. So we must keep up testing for surveillance to understand the spread of these variants. But our major defense now is to increase vaccination as well as all measures to suppress the virus spread in order to decrease the emergence of more variants that could change our current trajectory, which generally has been improving. And it could also change the efficacy of the current vaccines that we have. I'm going to move on to the tiers. We've been in the yellow tier now for 2 weeks, and almost immediately we saw a rise in case rates that I mentioned above. I think people have taken more risks. They've worn their masks less often. There are more gatherings. Mother's Day may have been one of those times when some precautions were not taken. Everybody is weary, frustrated. Some are angry. We want to end this and return to normal, and I get that. But we must continue protecting our families and our community, or we'll see even more contagion. The only new openings in the yellow tier included opening saunas, hot tubs, and steam rooms. Capacity limits were a little bit increased, and there are capacity bonuses if all who attend show proof of vaccination or recent testing. I'm going to review the recently updated travel guidance from CDC and CDPH, as this is the season when people will be making their summer plans. So first of all, if you're sick or you have recently been exposed, please don't travel. Number 2, wear your masks in crowded travel hubs and public transportation, regardless of your vaccine status, and maintain 6 feet of distance as much as possible from anyone who is not a household member, and avoid crowds as much as possible, and wash often or use the hand sanitizer. It is safer being fully vaccinated, and if you are, bring your proof of vaccination. If fully vaccinated, you may travel within the United States without testing and without quarantine when you return, unless you are ill or unless your destination requires it. If you're not vaccinated, get tested 1 to 3 days before you begin your travel and bring proof that it was negative. Also, test 3 to 5 days after you return and quarantine for a full 7 days, even if the test is negative. And if no test was done, quarantine should last 10 days. Avoid contact with more vulnerable people for at least 14 days and continue to self-monitor. And of course, if the test is positive, isolate for a full 10 days. International travel is a little bit more complex. You want to check with the CDC travel website. Since 80% of other countries on Earth now are on a no travel list due to COVID, that includes Mexico and Brazil and of course many, many others. Check the requirements of the other countries that you will travel through, and also the countries that that of your destination. Be flexible since policies are different and they may change. Vaccinations. Our supply now is adequate and there have been no more shortages. Now, anyone who is over 12 years old is eligible. Those younger than 18 years old can only get the Pfizer. There are no barriers now to verification. We require only proof of your name and an address. Self-attestation is acceptable. This is all private and secure, will not affect any immigration status or eligibility for Medi-Cal or other benefits. We are partnering with the schools to vaccinate all those over 12 years old and their family members. We are actually offering rewards now for vaccines, including vouchers for meals, donuts, drinks, game cards, and more is being donated every day. The community is really interested in everyone becoming vaccinated. It will open up our community even more. There is now planned a competition for a sticker design by and for kids. Hopefully that'll be out in June. And we have some PSAs being done, one by space and others are being considered among the school-age children. Because many health maintenance visits did not happen in the past year, the CDC and the American Academy of Pediatrics now recommend that all childhood vaccines, and this goes for other vaccines, can be given together with the COVID vaccine before or after it, with no more waiting period between the vaccinations. We'll continue some in the county, some large events, but having many more small events, including for individuals and very small groups. To support all this, we are continuing and increasing our outreach on social media, radio, as well as flyers, door hangers in English and Spanish, and billboards are in the works. Our current vaccination data for the county, which again does not include the federal government's Indian Health Service vaccines, the VA, or retail pharmacies. As of May 13th, over 74,485 people have gotten vaccine. I should say it differently. 74,485 vaccines have been administered in Mendocino County. 58% in our county are at least partially vaccinated. That's compared to 62% in California. 45% of our county over 16 years old are fully vaccinated. 55% of people in the lowest resource zip codes, or quartile 1, are at least partially vaccinated. 59.6% in quartile 2 are at least partially vaccinated. 45% of our Hispanic community are at least partially vaccinated, and 59.8% of our Caucasian community is at least partially vaccinated. By ages, those who are 16 to 17 years old, 30% have been at least partially vaccinated. 48% of the 18 to 49-year-olds, 71.4% of those people who are between 50 and 64-year-old, and 72.7% of those over 65 years old. Our vaccination clinics next week. Generally, our county has 1 to 3 clinics per day, all of next week, not including the weekends. Although this Sunday, one of the community clinics is going to be having a special clinic for the 12 to 15-year-olds. And the specifics about these clinics can be found on the county website or by calling your local community clinics. So in summary, while we're in the yellow tier, we have been seeing a worrisome rise in cases, hospitalizations, and intensive care unit cases. We are seeing more variants that spread faster and are more virulent. Numbers are small now, but we could see an exponential surge if this continues. So while we are opening our economy, we must be vigilant. Graduations are on the horizon, Memorial Day, July 4th, all the sporting events and travel that could happen over the summer could be super spreader events. I want to remind you that we are living in two worlds. Those who are vaccinated, including those who are vaccinated, can safely gather more. They can go to large events and travel with confidence. Those who are choosing to remain unvaccinated continue to have a risk of infection and also transmission to their loved ones and their friends. They must isolate if they're infected. Some will be in hospitals and ICU. Some may die. Others may suffer long-term effects that are just beginning to be seen at this point. And of course, if they come into contact with people who have COVID, they will have to quarantine, whereas the people who are vaccinated no longer have to do that. So my advice is continue to test regularly, vaccinate, and spread the word to family and friends. While there may be some local temporary side effects, there is nothing compared to the severity of the diseases. Continue to mask, keep distance from non-household members as needed. And this is changing, but the final word has not been written either from the state CDPH or even from CDC. So I'm being cautious here and staying away from the details. And if you choose not to vaccinate, be very careful to mask. Unless you are alone or outdoors with plenty of space, keep your distance from non-household members, continue your hand washing, avoid travel, avoid crowds. Avoid indoor dining, gyms, and big events. Vaccination is like liberation at this point. You can get out and do the things that are more normal for you when you become vaccinated. And with that, I'll end and be open for questions.
Thank you, Dr. Coren. Now we're going to open up to a few questions from the media. Leading us off will be KZUX and Z.
Okay, can you hear me?
Yes.
I can hear you.
Oh, great. Okay, so this is Sarah Reith, and given that steam rooms and sauna rooms and movie theaters and all that are open, and we just got some new guidance from the CDC last night about relaxing mask rules for vaccinated people, I'm wondering who is responsible for deciding when to reopen public meetings like Planning Commission, Board of Supervisors, and City Council and all that?
Within the county, we are developing our own safe reopening plan, and that has been developed by our administration and CEO Carmel Angelo.
Is there a timeline for when the meetings will be open to in-person participation?
There's a general timeline, and I think that we're thinking that in June, we'll start to open some of the county offices. More than that, I can't be specific. I don't have the plan right here.
So a lot of the county offices are open, but I'm talking about meetings for in-person participation.
Yeah, you're talking about the board chamber, for example, where we have the board meetings.
Right.
And that is not open yet, and it is actually undergoing some renovation at this point. So we want to see when it will be safe to open that and when the renovations will be done.
What about other meetings within the county, like the City Council and Planning Commission, and just the process of having in-person meetings? When will that be considered safe again?
I don't have the answer to that right off the top of my head. I think that's going to have to be a decision as we go through the summer and even before the summer, as we see what happens with masking and with the current possibly surge of cases that are happening now. The main thing that we want to do, Sarah, is maintain the safety of our community. And to that end, we don't want to have a lot of congregate meetings until we're pretty sure that it's safe.
How is it safer to go to a movie than it is to attend a political meeting?
I think the decision has to be made within the county administration.
So that would be our supervisors and CEO?
Yes.
Thank you.
Thank you, sir. Next up, we're going to have Mendocino Action News.
Hello, thank you for having this meeting again. So Dr. Coren, I know you said you didn't want to go into the details about the new CDC guidance, but maybe you can instead be more clear on how California decides their guidance and how you decide your guidance. I know before you said CDC doesn't have jurisdiction over California, but California Department of Public Health does. Could you better explain that for me?
Yeah, so CDC has written some advice, and for some and many jurisdictions, that will be the advice that they go with. And for California, I think the CDPH wants to be in step with the CDC, but we also want to take, they also want to take into consideration the science and the experience of the state as a whole, and it may be different than the rest of the United States. We have been very successful at bringing down the numbers of COVID cases, getting ourselves vaccinated under the guidance of the CDPH, using the equity-based plan. And so I'm waiting for the CDPH to decide. And the interesting thing about this is that, yes, people have talked about getting rid of all the masks in all these situations, but there's very little that's written down and agreed upon. So the CDPH has not really agreed on its final requirements. Plus, we're moving toward a period of time where they want to do away with the blueprint for a safe reopening of the economy. But one of the things that they have been talking about up until this week has been maintaining mask guidance for people in large crowds, or of course for people who are not vaccinated. And so I think there's some discussion among the people in CDPH what their final rulings will be. And they want that to be less confusing coming out than it was going into these restrictions. So they want to align it with all the other industry guidance. As far as Mendocino County, I would love for us to be in step with CDPH, because I think that that will be much less confusing for everyone. And I'm waiting for them to bring out their final instructions. But if we're having a very different experience in Mendocino County, we could establish different rules.
Thank you, Danilo. Do you have a follow-up question?
Yes, a separate question. Thank you for that answer. My other question is, let me find it here. I believe you said there were 4, I believe, recent cases, school cases. I'm wondering if that is related to Potter Valley going back to distant learning. I know that you said there were some sport cases in California. Could you elaborate on that at all?
The sports cases involved a coach and a member of the team in Potter, and they had played a team in Covelo, and there was some passing of the infection there. So they are definitely a school associated outbreak, but not a formal outbreak. So we have what we call a spot case open on them, because we're really following these cases very closely that happen in the schools. As it turns out, opening the schools has really not been a problem statewide or nationwide. The problems have come up, and they're few, but when they come up, they're involving sports. And probably it's because of the close contact in sports and breathing hard. So there's much more aerosol produced, and there's more contact. So sports has just turned out to be more of an issue.
Thank you.
Does that answer your question, Danilo?
Yes, thank you very much. Appreciate it.
Okay.
Next up, Mendocino Voice.
How you doing, Doctor?
Okay, how are you?
Good, good. So I wanted to ask 2 kind of opposite questions. The first is for people that really love getting vaccinated. There's been discussion, rumor about getting like the Pfizer and then the Johnson & Johnson on top of that, kind of like Pokemons, to and that there might be some benefit there, and especially since there seems to be a surplus potentially of the Johnson & Johnson because of the scare with it. So is that something that is safe, or is it something that I imagine you wouldn't recommend, but could you just discuss that?
Well, it's not recommended because we really want to have a 2-dose series of one vaccine. That's where you get the most immunity against these spike proteins. They're very specific against certain proteins. If you mix and match, the concern is that you're really not increasing the immunity, but you are potentially increasing the risk of vaccine reactions. And then the one-shot Johnson & Johnson is a very different kind of vaccine. And so far, there is no research, no proof that it'll work better in conjunction with another vaccine. And again, there may be more side effects that we just don't know about. So the advice is get the vaccine that's available to you. That's going to give you your best protection. And then you don't need another vaccine until we decide you need another vaccine. We haven't gone that far yet in time.
Right, but I wasn't saying mix and match. I was saying 2 Pfizer or 2 Moderna and then the Johnson & Johnson, or 2 Pfizer, 2 Moderna, and then another 2 Pfizer and another Moderna. Would that be something it's something I've heard people discussing? Would that be something too?
Well, there's a difference between discussing and advising and thinking about it and really coming up with plots and plans and something that's safe and effective. And so there's nothing been written about that I've seen.
Okay.
So I wouldn't advise it.
So from the enthusiastic vaccinators to people that are more reluctant, do you have any, I guess this is a two-parter, do you have any data coming in now about, are we hitting that wall of reluctance, of actual reluctance to get vaccinated, or is it still just an issue of sort of access to vaccination? And what is, I know there's a lot of research around this, but what is sort of a tolerable level of people who aren't vaccinated in our society in order to have some kind of herd immunity? I mean, can we tolerate 30% of people who just are very anti-vaccine, and it'll be, and the rest of people sort of cover them, or is it a higher threshold? Can you shed any light on that?
Okay, well, let me break it down into two things. Do we have evidence that there's some reluctance? There has been a definite fall off in Mendocino County, in California, in the United States, of people who are lining up and filling these large vaccine events. And so we're pivoting away from the very largest vaccine events all over. And as we've done in Mendocino County, we're aligning events with the size of the people who want to come in, our estimated sizes, and we always have some extra. In addition, because there have been a lot of seats that have been unfilled in these vaccine events, and our supply of vaccines is quite adequate now. The CDC has released advice that we should worry less about wastage. And even if we have a vaccine or two, or even a few more that are not given out at the end of the clinic, we should try and get every person vaccinated who turns up to be vaccinated. I hope that answers the first question. So there is a point of reluctance. There's always in anything in society. There are people who are going to be the first people who line up, the early adapters. There'll be others who want to follow, and there'll be others within that group that there'll be some resistance. So we see it in waves. As far as herd immunity, the numbers for herd immunity are, calculated, and that's a very theoretical calculation. So although you've heard 65, 75, 85, 90%, I've even heard higher than that to achieve herd immunity. The honest to God truth is we just don't know for sure. I think we're aiming for 75% if we can. One county south of us has already hit over 80% of the adults have been vaccinated, and that's fantastic. But in our county, it's significantly less, and we need to keep pushing. It may not happen as fast as the first early adapters lining up. It'll be slower, but we want to make sure that everybody is encouraged. And I think they will be encouraged when they see, one, that it's safe, and two, how effective it is. I mean, look, there is nobody who's being vaccinated who's winding up in the hospital, in the ICU, or dying from COVID. It just isn't happening. And the side effects are, for the most part, very mild. There are some cases of anaphylaxis with the mRNA vaccines, but they're very treatable, and there haven't been any, significant, any recent deaths. There certainly have not been anything like that associated in Mendocino County or Northern California that I've heard about. So it's very safe and extremely effective. It is the way to going back to normal.
Thank you, Doctor.
Thank you for your questions. Next up is going to be KMUD. Anybody from KMUD? All right, not hearing anything. We're going to move on to the Press Democrat.
Oh, great, thank you. With the case rates ticking up in the county, is there any concern about falling back into the orange tier before full reopening next month, and when could that happen?
So cases have increased in the last few days, the last week. It hasn't consistently affected our case rate. The blueprint tier criteria involve not only the case rate, but the case positivity rate, our vaccinations, the availability of the vaccines, And, and so there are a number of more factors. And although I was very nervous about it when we first had a week where the case rate seemed higher, I was reassured that, it's going to take a bit more. Now we have 2 people in the hospital med-surg and 2 people in the intensive care unit. And if the cases continue going up, then we could be told we would have a week in orange. And we would, but we would need to have, we would have an orange data, but we would need to have 2 weeks of the orange metrics to consider moving us back to the orange tier with the restrictions from the orange tier. So it could happen, but it's unlikely at this point.
Got it. Great. And then as far as the increase in new cases, who is that mostly among younger people? I guess obviously it's among unvaccinated people, but who are the people, what's the demographic maybe that's driving the new cases?
Yeah, it's definitely younger people, although some of the people over 65 have gotten very sick. And of course, the most recent person was in her 60s, and the person before that was 67. So it still is hitting the older demographic and in the most serious ways. But we're seeing COVID significantly increased in the 18 to 49-year-old group, and they are the ones who are the least well vaccinated. We want to get them in. Those are people who may be working all day, just haven't gotten around to doing it. We're trying to cater our vaccine efforts to them while we're also addressing the young people in our community and schools, the 12 to 15, 16, 17-year-olds.
Great, thank you.
Thank you for that, Ethan. We do have a question from the community, so I'll read that right now. It's a local business owner. He asks, he or she asks, the gender is not specified, sorry. With the CDC guidance, what can we expect wearing masks for all frontline retail team workers operating indoors and outdoors?
This goes back to what I was saying before. The CDC guidance the president said something and CDC walked it back a little bit. The governor said something about a week or so ago, and it was back. He walked that back a day or so before, or a day or so later. And CDC has not come out with their final guidance, which really will determine what's recommended and what's allowed in our state. But I think that while people are facing the public, we still want to protect those employees. And so it'll be best for them to be masked and use the barriers that they need. As more and more of them are vaccinated, we may see that requirement will decrease. And there may be some business owners who say, we're only open for business for people who are vaccinated or can show me proof of vaccination and proof of a recent negative test. And that would make their store, a COVID-free zone in a sense, and really increase the safety. But we don't really have those that guidance yet, or those strategies yet that I would depend on. But I think as more of the community is vaccinated, there'll be less of a requirement to do a lot of the restrictions that we've done. My thinking is masking is the safest, most accessible, and most protective non-pharmacological intervention we can have. And I think that, for these contacts that people may have that have been the cause of community spread that we've seen throughout this is the most important way that the disease is spread through our communities. Masks are still very high on the list, and we shouldn't be so anxious to give them up.
Thank you for that, Dr. Coren. We still have a little bit of time, so I'm going to run through the media one more time with one follow-up question each. Leading us off will be K2X and Z.
I'm actually done. I'll yield to someone else. Thanks.
Thank you. Mendocino Action News, you're up next.
Okay, I have a question. I just need to find it. I'm sorry. Can somebody else go ahead of me?
Sure. Mendocino Voice.
Yeah, Dr. Coren, if you could elaborate a bit more about the particular dangers of the double variant and the Brazilian variant that you said have been they've been confirmed to be in Mendocino County, and if you could provide us with specific dates about when those tests were taken, so we have some idea of how long those variants have been in the county.
So the Indian variant has not been found in Mendocino County. The Indian variant was found in some other surrounding counties in Northern California and the Bay Area.
Can you say which ones?
I don't know offhand. I think that there was a small outbreak in Marin. I could be mistaken. Okay, so that one has not been. What we have seen is the UK variant B117, and we've seen a trickle of those, 1 and 2 here and there, and they're usually way outside the period of time that we can effectively trace them, or have we found them associated with any outbreaks that we could tell. So the ones we found were not associated with other ones we found, and they were not in the same place at the same time. We only found one of the Brazilian variant that came from testing positives. But this, so this whole genome sequencing process is really for the state to get a sense of how this is traveling, how it's increasing. They were able to say that, back in January, there was hardly any variants. Then during the surge, of course, we had the California variant was dominant. And recently the UK variant has become a significant variant in the state and in other states. We're still not seeing outbreaks from those variants because of the high vaccination levels that there are in California.
And just that Brazilian variant, when was that? Last week? Was that a month ago? How long ago did that?
I don't have that right in front of me. It was not in the last week. It was in the last, I think it was in April.
Okay, thank you very much.
Next up, Press Democrat, Ethan. You still on the line, Ethan? All right, I'm going to go back to KZX and Z. I believe Alicia had a question that she wanted to ask.
I believe that was me with Mendocino Action News.
No,
Oh, sorry.
Mila. Hey, sorry, I was muted. Hi, Dr. Coren. I think the news of the day, of course, is the CDC's announcement that they are saying now that vaccinated people don't need to wear masks or socially distance. And I'd just appreciate if we could get a clarification as Mendocino County residents. How should we respond to that advice? Is it time to throw our masks out the car window, or do you want us to stay the course, keep wearing masks, keep socially distancing until the California Department of Public Health comes out with guidelines, you review it, and then come out with guidelines for the county?
Yeah, absolutely. The CDC is not the agency that has jurisdiction over California. They create advice, but do not have the same guidance effect on the states. They're a research body. They're very respected. They're very good. But it's also, they're coming at it from the point of view of the entire nation. And the CDPH is going to take that information and also local information and come out with their recommendations. And so at this point, it is stay the course and do what we have in the current guidance. Yeah.
Thank you.
Thanks.
Mendocino Action News, you're up next.
Dr. Coren, you've said, I think, I'm trying to remember, back, maybe it was a couple weeks ago, we were talking about Johnson & Johnson vaccines and some reactions. I think there was 2 cases per million women regarding the, risk blood clot condition. And then you said there was something to do with men. Recently, there's a rumor going around town, about a vaccine causing some severe reaction to a case in Mendocino County. Can you either debunk that or add to that? Has there been any severe reactions to vaccines in Mendocino County?
I have not heard of any, no.
Thank you.
Thank you. Sarah, did you have your follow-up question?
No, I think Alicia just asked the best question of the day.
All right. Well, with that, that sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren an opportunity to give a concluding comment if you'd like.
Well, I would just reiterate, we're really seeing an increase in case over the last week. That doesn't mean there's a surge, but it means that I'm worried. And I do want people to understand that there are really two different worlds now. And, the world of the unvaccinated is more younger people, 18 to 49, people in the prime of their lives. And they're the ones who are being sickened most by this COVID vaccine. Of this COVID virus. And the vaccine can break them free of that. That's their way to get to ball games, to get to gatherings safely, to do what they want to do. And the vaccines have proven very effective, not only for preventing the illness in ourselves, but transmitting it to our loved ones. And it really is the light at the end of the tunnel. And they're safe. They're very safe. So they're safe and effective. And we want everybody to come over into the world of the vaccinated so we can let down some of the restrictions and probably more safely reduce the use of masks. That's what we want to see. So I hope everyone stays safe, plan well for the upcoming season of gatherings and of travel. But in order to do that, really, I want to emphasize, get vaccinated.
Thank you, Dr. Coren. Our next update is scheduled for May 28th. Please continue to follow Mendocino County Public Health on our Facebook page for all COVID updates. Thank you for joining us, and I hope everyone has a great weekend.
I know.